Hello everyone, Christie Amundson here with Impact Physical Medicine, coming back at you on our Impact Your Life channel. I am a physical therapist and I am also 9 weeks postpartum. This is my son Dash, who's going to be helping me out as my co-host today. We're going to be talking about 5 common breastfeeding mishaps or mistakes that can be easily made and easily corrected. So I have Dash as my 4th baby that I have breastfed, and as I work quite often with postpartum new moms who are struggling with musculoskeletal pain, be it in their upper back, in their shoulder, in their wrist, in their hip, in their lower back, or anywhere for that matter, in trying to problem solve different positions, both for baby and for mom, to help make the breastfeeding experience a positive and enjoyable one. So we're going to go through these 5 most common, I shouldn't say most common, but certainly common breastfeeding mistakes that I see. Number 1 is making sure that, actually 1 and 2 have to do with the mother's comfort, relaxation, and support. So number 1 is making sure that your back is supported. So often the mistake that I see is people will just take one small pillow, usually like a throw pillow from the couch, and stick it right behind their lower back, and think that, okay, my back is supported. What you really want to do is have the support running all the way up your lower back and upper back and neck if you're in a position that isn't upright. So since I am upright, I don't need anything behind my head because my head can balance on top of my torso. However, if I was in a more reclined position, that I am going to want something behind my head so that my head can relax in that position and doesn't feel like I have to lean forward and pull it forward like this. So number 1 is making sure that your back is totally supported, both lower and upper back, so that you can lean back and you not have to kind of make this C position with your spine and neck. Number 2 mistake is oftentimes when mothers are nursing, they have a lot of tense or muscle tone in their upper shoulders, upper trap region. So when they're holding, especially in like a cradle type position, they tend to hike their shoulder up like this, unintentionally, of course. What you want to do is use, this is a breastfeeding pillow. It's called my Breast Friend. There's also boppy pillows. You don't have to have a nursing pillow. You can use just pillows from the couch or from your bed. And you really want to pile them up enough so that you do not have to hike your shoulders. So get yourself in the position, get a good latch, and then take kind of inventory of your shoulder position. I often will say I use the song Head, Shoulders, Knees, and Toes, and I'll say head, shoulders, back, and toes. So when you're examining your own body as far as your position while you're nursing, you want to make sure your head and neck is in a supported position. You want to make sure your your shoulders are not up like this. You want to make sure your back is supported like we already talked about. And lastly, you want to make sure your feet, if they are weight bearing on the bottoms of your feet, you want them flat on the floor and not up on your toes like this. So taking inventory of those things can easily avoid those 2 mistakes. Number 3 is going to be making sure that your baby is in a position that facilitates swallowing. So you often see it most commonly in a position where you're kind of a cradle hold or a cross cradle hold, where you're cradling the body in the crook of your baby in the crook of your arm. Oftentimes in that position, the baby's belly is up toward the ceiling. And if you try to nurse in that position, they have to turn their head all the way to the side to find the nipple. If you try to turn your head to the side and swallow, you will notice it's a lot more difficult than if you keep your head straight. So you want to make sure that when you're holding your baby that you turn their tummy in toward your tummy so that they are comfortable in a position that they can easily swallow. And you notice my other hand here is making this kind of C. If you make a C with your hand and you wrap it around the back of their head, and the base of your heel of your hand is between his shoulder blades. And so if I push with the heel of my hand a little bit to help direct him toward my nipple, it will facilitate a little bit of neck extension And your baby also needs a little bit of neck extension or tipping their head back to be able to swallow. So again, if you tip your head back just a little bit, swallow, that should be relatively easy. If you bring your chin down like this and try to swallow, it is much more difficult, if not impossible, to swallow in that position. So if you're taking the back of their head and pushing it and trying to direct it with the back of their head, again, not only are they going to push back into you as a reflex, but that's not going to facilitate for them to be able to swallow very easily, and it won't facilitate a very nice time for them or you. So number 4 is just timing. I have a lot of moms who aren't sure about how long to be nursing. Sometimes they'll just set a timer and do 10 minutes on this side and 10 minutes on this side, and there's no right or wrong answer. Every baby is different. But if you think about if, somebody put a plate of food in front of you and said, set a timer for 10 minutes, and at 10 minutes they took away your plate of food, that might not make you very happy. In addition, if you're, they set a timer for 10 minutes and you were done at 5 minutes and they, were like, you got to keep eating until the timer goes off, that also doesn't facilitate, happiness either. So, there's no right or wrong answer for the amount of time that an infant nurses. However, a good way to tell when they are finished is usually when they're hungry and actively sucking, they will take their arms and they'll be in close to their body and they'll make tight fists with their hands. When you can easily pull their arm away from their body like this, they may still have a fist, but when you can take and kind of like see their armpit, bring their arm away from their body relatively easily and they're pretty relaxed, that's a good sign that they're finished. Lastly, number 5, is considering symmetry. So I see this maybe a little bit less commonly, but everybody, or I shouldn't say, or most people have a common, or is one side dominant. So for example, in this position, if I were to be nursing him, obviously I would have him rolled toward me a little bit more, but he is laying on his left side. So to look at me, his eyes have to turn up to the right. Now, if I nursed him like this on my right side, and then I nursed him like a football hold on my left side. So again, when you're nursing, you obviously want to go on both sides, or at least alternate on both sides each session. But you notice he is in a relatively similar position in terms of weight bearing, lying on his left side. His eyes are turning up to the right to look at you. So you do want to have some balance and some symmetry. So meaning occasionally that would mean I would lie him on the opposite side and nurse this way, so that he's weight bearing on the opposite side and his eyes are turning up the opposite direction. Obviously, if you're doing the same hold, like a cradle hold on both sides, you would be alternating. But I have seen moms who, have one arm significantly preferred or stronger, and in that case, they would, do kind of a cradle hold on one side and a football hold on the other, and that way the baby isn't really getting balance or symmetry. So you want to vary it up a little bit. And then I have one last thing as a bonus, and this really isn't necessarily exclusive to nursing or breastfeeding. It's basically any feeding, but just try to remember to burp your baby after the sessions. I know it can be really tempting. They often doze off after the sessions. It can be really tempting to just leave them there. However, gas can be really uncomfortable for babies, and it's one of the most common reasons that you'll see them crying inconsolably. So on cue. So you want to make sure that when you burp, there's no real right or wrong way to burp other than the fact that you want them in at least a somewhat upright position so that gravity can help you out, and you want some pressure, just mild pressure on their stomach. So if they're sitting, that pressure can just come from their legs pushing up against. Also, if you have them against you in this kind of typical burping type position, you don't have to, some people like to rub, some people like to pat gently. If you think about like a glass with carbonated water in it, usually you think about those bubbles, that's what we're trying to get out. And it doesn't take much on the side of the glass to get the bubbles to come to the top. So again, very little pressure, but can be very helpful. So those are 5 common breastfeeding mistakes with a nice bonus tip at the end. I hope it was helpful. If you found this helpful, please subscribe to the channel and click the bell icon to get notifications of new episodes. And we will see you next time. Bye-bye.